Hi everyone, welcome to webinar 7 in our data exchange webinar series in the Targeted Early Intervention program. In today's webinar, we're going to talk about creating cases, sessions and clients for activities in the Wellbeing and Safety stream. If you haven't already, please make sure you watch webinar number 5 before you continue with this webinar. Webinar 5 lays the groundwork for a lot of the content that I'll go through today. So please watch that one before you continue watching this. So there are two key things this webinar discusses. I'll take you through a number of different examples of activities in the Wellbeing and Safety stream, and we'll talk about how to set up your cases and sessions for those activities. And we'll also talk about when to record individual clients and when it's okay to record an unidentified group. So, as always, in our previous webinars, I introduced everyone to this document, the Data Exchange Quick Start Guide. This is a 5-page document that outlines the 11 key steps you need to follow to access and start using the data exchange. So it includes links to all the key resources you need to complete each step. And as you can see on the slide, it includes a checklist so you can keep track of where you're at. And in each of our webinars, I've been taking everyone through each step in this document. So we've accessed training materials, we've subscribed to the newsletter, we've created our outlets, and we've also looked at our privacy consent obligations. And in today's webinar, just like our previous two, we're going to continue tackling steps 8 and 9, but we're going to be very focused on the safety and wellbeing stream. So we'll look at what information you need to collect from clients when you deliver activities in this stream, and we'll look at how to set up your cases and your sessions for the activities that you deliver in the safety and wellbeing stream as well. So to get started, I am just going to do a quick recap of some of the things we learned in our previous webinars. So by this stage, you should all know what an outlet is. It is the location a service is delivered in. Outlets are the first thing you need to create before you can start reporting. So if you haven't set up your outlets yet, please go back to the previous webinar on setting up outlets and go through that process before you set up your cases and your sessions. Once your outlets are set up, you can start finally recording your data. So the first thing to do is to start setting up some cases. So cases store information about program activities and outlets. And as you can see in the diagram, they link relevant sessions together, which then link clients together. So they kind of act like a container for a specific activity that you deliver. Once you have created a case, you can then start to create sessions. So sessions are individual episodes of service. So every time you meet with an individual client, with a family, with a group, you will create a session to show that you delivered a specific activity on a specific day to a specific person or group of people. And then the last layer of data entry are our clients. So you can attach clients to a case to say these are the people who will be participating in this activity. And then you also need to attach clients to specific sessions to show who participated in that specific session on that specific day. And as we discussed last week and the week before, you can also record a number of unidentified clients at the case level and the session level. So what we're going to do now is I'm going to go through some common activities that are conducted in the Wellbeing and Safety stream, and we'll talk about how to report those activities in the data exchange. So how many cases to create, how many sessions to create, and if you should have individual clients or unidentified clients. So the first example we have on the screen is 2 playgroups. So this organization runs 2 playgroups, one in A town and the other is in B town. And they've got an outlet for each playgroup because they're in 2 different locations. They then have a case for each playgroup. Then underneath that, they'll create a session each time the playgroups meet. So clients for playgroups will most likely be individual clients. So they will attach individual clients to the relevant sessions they attend. And then you can basically record any group activity this way. So you just need to create a case for the group and then create sessions every time the group meets. The second example I have is also for a play group, but it's been set up slightly differently. So in this example, they only have one outlet, and that's their community centre. This is because both of the playgroups they run are in the same location. So in this example, they run a playgroup specifically for 0 to 1 year olds, and they run a playgroup just for dads. So they've created one case for all of their playgroups, and then they create a session each time a playgroup is hosted. So if you wanted to, you can set up your cases and your sessions like this. You can have one case for all of your playgroups, provided they are in the same location. Even if your playgroups are in the same location, you could also have separate cases. So you could have a case just for the 0 to 1 year olds, and you could have a case just for the dad's playgroup, or you can do it combined like this. It's completely up to you. The next example I have is for a group parenting program. So in this example, they've just created one case for the program. And again, they just create a session every time the group meets. So again, for an activity like this, we would expect that clients are individual clients. So you would just attach the individual clients to the relevant sessions they attend. And again, you could apply this same logic to any sort of group activity where the same group of people is meeting on more than one occasion. So you'll just have a case for your group or your program, and then you can just create a session every time the group meets. Our next example is slightly more complicated. This is also for a parenting program, but it's being delivered one-on-one. So it's not a group program, but it's an individual parenting program. So one way that you could record this would be to create a case for each family who participates in the program. So you can see in the case IDs, we've got Engaging Adolescents, because that's the name of the program. And then we've just got family 1, family 2, etc., etc. And every time you meet with a particular family, you would add a session to their case. For an activity like this, we would expect that clients are individual clients. So you would just attach the individual clients to the relevant session they attend. This can be really useful if you're working with a family with 2 or 3 people, and the first time you meet with them, there might be both parents and 2 kids, and then the second time there might be 1 parent and 1 child, and then the third time there might be both parents and 1 child. So you can just attach the relevant client to the actual sessions they've attended, so you can get a really good picture of how many sessions dads attended and how many sessions mums attended and how many sessions the kids were present for as well. And again, this same kind of logic could be applied to any sort of individualized activity like counseling or case management or something like that. Our next example is actually case management. So you can see it's been set up the same as the previous example. We've got 1 case per family, and a session has just been created every time they've met with the family. So you would attach individual people to the sessions they attend. Now, we know that in case management, it is likely that you'll provide a range of different services to the families that you're working with. So when you create your sessions, you can pick different service types to capture the kind of work you did with the family. So if we look at that green column, the first session was intake and assessment, the second was material aid, and the third was family capacity building. So if you do this, you just need to make sure that the service types you pick align with what is in your TEI contract. And if I just skip to the next slide, one other important thing to remember is that you can only select service types that sit under the chosen program activity. So in this example, the program activity is targeted support. So this means that when you create your sessions, you can only pick service types that sit under targeted support. If you want to know more about what service types sit under what program activities, there is a document on the TEI website called TEI Program Specifications. This includes a list of the 5 TEI program activities and the service types that sit underneath them. And it has descriptions for each service type as well, so you can get a really clear understanding of what is the most appropriate for the activity that you're doing. So please check that document to see what service types are available for the program activities you're conducting. And also, please always make sure that you're only selecting program activities and service types that you have actually been contracted to deliver. You need to make sure you're checking your TEI contract to see what service types are in your contract to make sure that you're reporting against those service types. Okay, so the next example I want to go through is about recording referrals. So we did discuss this in the week 5 webinar when we first started talking about cases and sessions and the mandatory information that needs to be reported. So in the Wellbeing and Safety stream, the overwhelming majority of your clients will be individual clients. So this means that you can record referrals for them in the sessions that they've been attached to. So basically what happens is once you've created a session and you've attached your clients to it, you can record any referrals that occurred within that session. So you just select the relevant client and you'll be taken to a screen that looks like this on the slide. And then you just need to select the type of referral, so internal or external, and the reason for the referral. And you can select multiple options as well. So I think there's 11 different reasons in that list, and you can select as many reasons that are relevant to the referral that you've conducted. So you would do this if, say, for example, after a playgroup, you're talking to one of the parents and you find out they've lost their job. You might refer them to some employment workshops your organization runs. So you could capture that referral in the session for the playgroup that you ran. You could also do this if you're running a parenting program. You might realize that one particular family needs more support. Maybe mum has some mental health issues. Maybe there's some domestic violence going on. Whatever the referral is, you would just capture it in the existing session where you spoke to the client about the need for some additional services. Recording referrals in this way can only be done for individual clients. So the client has to actually have a client record in the data exchange. And there's no limit on the amount of referrals as well. Whenever a client participates in a session, if you've referred them to another organization or to another activity in that session, then you can capture that referral. You might refer a family every single time you meet with them. So you can capture every single one of those referrals at every single session that you run. I really encourage everyone to use this mechanism index to record referrals because it gives you really valuable information about how clients are engaging with the service system. So on this next slide, this is an example of some of the data you'll be able to see once you start recording referrals in that way. So we can see how many referrals were internal or external, and you can see the reason for that referral. And we can use this information to improve our service delivery. So let's say, for example, you find out that there are lots of internal referrals in your organization for mental health reasons. Maybe that means there should be something extra you need to be doing at intake to make sure you're picking up on those issues as early as possible. Or maybe there are lots of external referrals for a particular issue, and that might present an opportunity for you to engage with other services in your local community to advocate for a community level response to those issues. Another way you can record referrals is you can create a new session specifically for the referral. So this is most likely only going to occur within a case management context or when you're conducting an assisted referral. So you can create a session specifically for information, advice, and referral. That's the service type you will select. Then attach the relevant clients to it, and then you can record the type of referral and the reason for the referral as well. I would only recommend doing that if it is an assisted referral or if a lot of time and effort is going into the referral. So you're spending at least 30 minutes with the client figuring out exactly what their needs are and exactly what services they want to go to or they feel comfortable going to. So another question that we get asked all the time is what to do when a client receives multiple services. So what happens when a mother attends your weekly playgroup, but she's also participating in a parenting program and some group counseling sessions? How do you capture all of that? This is actually very simple. So all individual clients will have a client record in the data exchange, and they only need one client record. So once they're in the system, that's it. You don't need to enter them again. And then all you need to do is when you create a case and a session for a different activity, you just need to attach the clients who participated in those activities. So when mum attends the playgroup, she's attached to those sessions. When she goes to the parenting program, she's attached to those sessions. And same goes for the group counseling. When she participates in a session, she's attached to the relevant session. The only tricky thing is that your organization will need to come up with a way to ensure you don't duplicate client records. So when you create a client record in the system, it will prompt you if you've entered a client name and some other details that match an existing client record. So you should use that to determine if a record already exists for your client, or you could come up with another system within your organization to determine if a client already has a record. There are some organizations I've spoken to that have Excel spreadsheets with some information about client IDs and client names, and people are instructed to check that before they create a client record. And I'm sure there's lots of different ways that different organizations are doing that. Yes, okay. So one of the last things that I wanted to show you is something that I've already showed you in the last 2 webinars, but we'll go over it again really quickly. So in the Wellbeing and Safety stream, there are 2 program activities. So for these program activities, we do expect that 100% of clients will be individual clients, so there won't be any unidentified groups. However, we know that this won't always be possible. So we know that for some clients you work with, it won't actually be possible to collect demographic information from them. Some of them will even refuse. If absolutely necessary, you can record those clients as unidentified clients. What you could also do, though, is you could create a client record for them in the data exchange. And over time, as you build a rapport for them and you earn their trust, then you can start to populate the client record with all of the necessary demographic information that you need. The good thing about the data exchange is that once we've got a client record, that's kind of all we need. So we can go back to it and change the information in there as much as possible. So if you wanted to, you could put in a pseudonym for your client. Maybe they don't want to disclose to you their full name, but over the 3 to 6 months that you're working with them, they finally do. So then you can go back to their record and you can change that to make sure it's providing the most accurate information as possible. But also remember that you can de-identify clients in the data exchange. So if a client doesn't want their personal information stored in DEX, you just need to make sure that you untick the consent box, and that means that their name and their address won't be stored in DEX anymore. Like I said before, you can also give them a pseudonym. So you can see on the screen there's a little box that you can tick that says name given is a pseudonym, and then you can just enter a fake name for the client. You just need to remember that that's the fake name you've given them. So when you go back to update their record, you know exactly which record to go to. If they don't want to give their actual name of birth, you can just provide an estimate as well. There are lots of things you can do to help make clients feel more comfortable about disclosing information about themselves to you. If you do de-identify a client, so if you do untick that consent box, the one that's circled red on the screen, you need to remember to keep a record of the client ID. So when you untick that consent box, their name won't be stored in the data exchange. So you need to keep a note of what the client ID is, so you can go back to the record to add them to any additional sessions they're participating in, or to record outcomes for them, or even to update demographic information about them as well if that changes. So that's pretty much it for today. As you can see on the screen, there are all of the resources that will be useful for you when you get to this step. So on the left are the resources we, DCJ, have developed. So please download these and have a read. They include countless examples of how to record information in DEX, what to record, more examples than what I took you through today. So if you ever need help figuring out how to organize your cases and your sessions, please take a look at the examples in those resources. We update these documents all the time as well. So if you ever get stuck, please hop onto the website and have a look, because there might be new examples in there that might help you out. And then on the right are all of the resources DSS have developed. So these walk you through how to navigate the data exchange platform. So when you're ready to start actually creating a case and a session and adding your clients, you can download those resources to help you figure out how to do that. And as always, here are all of the different places you can go for help with different things you might need help with. When it comes to figuring out how many cases and sessions to have, my advice would be to email TEI or talk to your contract manager, your CPO, and we can help you figure out how many cases and sessions you should have and whether or not your client should be individual clients or unidentified clients. That's it for today, guys. Thanks so much. I'll see you in the next webinar.